And welcome to Farm to Home with my special guest, Thomas McDowell. He is a registered pharmacist at Medical Park Pharmacy inside of the Boyce Willis Clinic.
Thanks,
That's a mouthful.
Yeah, we Rocky Mountain Medical Park Pharmacy, but we'll shorten it to Medical Park Pharmacy. It is a mouthful. Glad to be back. I really enjoyed last segment.
So glad to have you. Had lots of comments and a lot of information imparted on this segment. I think y'all are excited about it. So let's get right to it. Today, Thomas emailed me. As y'all know, we have alluded to the topic already a couple of days here. Insulin coverage for diabetic patients. Yep. And there's so many diabetic patients, especially Edgecombe and Nash counties.
Yes, yeah. In the United States, there's over 30 million folks living with diabetes, and about roughly 8 million of those patients are using insulin. So there's a lot to unpack there. And last segment, we touched on Medicare coverage of the shingles vaccine.
Yes.
And now that's zero for Medicare patients if they have a Medicare D plan. With that legislation, there's some other, key pieces of information in that prescription drug law that took place January 1st of this year. And one of those things is a cap on the copay for insulin for Medicare patients.
That is wonderful.
Really excited to get into some detail on that, because one of the biggest issues that we see at the pharmacy is the affordability factor of insulin. It's gotten to be so expensive.
Yes.
And it's a necessity for those patients. They have to have insulin for those patients that have reached that level of needing insulin to manage their diabetes, whether it's type 1 or type 2. It's really, really important, and we hate to see patients having to choose, food or medicine, or, paying rent or utilities. And so really excited about this new rule that started January 1st. So the basics around it are copays are going to be capped at $35 per month supply for insulin, and that's any kind of insulin, specifically for Medicare patients.
Okay.
And I would love to see that be the case for all plans, but right now it's just Medicare patients. And so usually what patients will see at the first of the year is they have a big deductible. They come in January, and if they need their insulin, sometimes it's $400 or $500.
If they can't pay that, let's get real. If they're on Medicare, Social Security, they can't pay that.
So fixed income, it's really hard to pay that lump sum for patients. And so that $35 copay cap, you don't have to pay your deductible. So that's eliminated. It's going to be $35 per month supply. So it's not necessarily per box of insulin. It's per month supply, and that's based off how many units you're using. So if you got a 60-day supply, it'd be $70 and so forth. But the good thing is that $35 copay does go against your deductible. So it benefits you, but you don't have to worry about paying that really high out-of-pocket amount.
Well, that is wonderful news. That is a big step to go from possibly $400, $500 to $35. That has to be a relief.
Absolutely. So we wanted to share that information because we don't want to see any patients that are potentially holding out on getting their insulin this year if they didn't know about this new rule. And so if you're waiting on getting your insulin due to cost, you can rest assured that it'll be $35. Now, that being said, there's if you have a plan that's a little slow getting their systems up to date, they might not have that $35 copay set in their system, but that plan is responsible for reimbursing the patient pretty quickly after, I think it's by March 31st.
Okay.
So, but from what I've seen, all the plans are up to date so far from what I've seen.
Good.
But if you do go to the pharmacy and your copay is higher than $35 and you're on Medicare, if you have Medicare D or a Medicare Advantage plan, then they should reimburse you. You can call your customer service line for your health plan, for your Medicare plan. But just keep in mind, the pharmacy simply runs the claim. And so unfortunately, we don't have control over the copay, but we can definitely be a good source of information. And so if you have questions about your insulin or your copays or whether it applies to you, contact your local pharmacy. That's what we're here for. We deal with insurance every day, and we can help you navigate those complexities. And so some people might also be wondering, well, what's going to happen when I go into the dreaded donut hole?
Yes.
And so if you're not familiar with the donut hole, it's usually donuts are a good thing. This is not a good use of the word donut. It's a coverage gap for Medicare patients where when between what they spend and what the plan spends reaches that $2,000 threshold, the patient becomes more responsible for their copays. So the plan shifts responsibility of the cost of the drug to the patient, which leads to higher copays. Well, this rule about capping the cost of insulin still applies in the donut hole. So you will still only have a $35 copay per month supply. So that's something that most patients are dreading, and usually they get there around August, September, and it can be really difficult to afford their insulin in the latter part of the year.
Absolutely.
So you've got your deductible phased in the donut hole. That's all out the window. $35 per month all year long.
That is wonderful. That is just, I know people are so happy. If you did not already know this, this is good news, and I know it makes you feel good, a big relief. But as Thomas said, at any time, you can certainly, Thomas, his staff, will certainly answer questions. If Thomas is not there, there are other pharmacists there that will definitely answer your questions. So ask the experts.
Well, we're happy to help, and we've got a great crew. And if you're confused about your Medicare benefits or what medications you're taking or whether you should be paying that $35, call your pharmacy. And if your pharmacy is not able to take that time and talk to you, look into a different pharmacy, because not all pharmacies are the same. And so we'd love to, for you to give us a shot at the local independent pharmacy, and we'd be happy to help. One piece that I did want to touch on as well is your plan still can make adjustments for your insulin coverage as far as formulary and what medications they're covering throughout the year. So that still applies, and but they do have to notify you if they're going to change, whether they're going to cover Novolog this month versus Humalog the next month. And that's also something that we can help you with. If you're getting confusing letters from your insurance plan, bring them into the pharmacy. We can help you digest all of that information. And again, it only applies to insulin. It does not apply to other non-insulin injectables for diabetes, like your Ozempics, your Mounjaros, and Victoza, and some of those medications that are used for diabetes, but they're not technically insulin.
Yeah, they're not, even though there's still an injection, they're not insulin.
They're not insulin,
Okay.
so it's only insulin. So if you're on one of those injections, your typical deductible and donut hole rules are going to apply. But with the amount of folks that we see on insulin, it's a huge relief for those patients. And if you're one of those patients that, I'll touch on this, that has recently started insulin, but you're on a really low dose, talk to your pharmacist about some potential lifestyle changes. So if you're not on Medicare and you're having trouble affording your insulin, if you just started out on insulin and you've just been diagnosed with diabetes, a lot of patients are able to reverse that. And that's not something that everybody knows. Not everybody, but there's potential to reverse type 2 diabetes, not type 1.
Right.
But type 2, which is usually brought on by a result of lifestyle and diet and genetics. But you can, with some help and guidance from your pharmacist and your primary care provider and so forth, you can make some changes that can help you get off of insulin, because nobody enjoys injecting themselves every day.
No, I'm sure they don't wake up and can't wait to get to the next injection, insulin injection.
And so a lot of times they're having to do those injections 3-4 times a day. And so it's a burden, not only the cost, but just the lifestyle that it brings on. And so we're a resource for that. We can help you implement some lifestyle changes to help, lose weight and create a healthier diet and create a plan for exercise. And so utilize those resources around you. And another thing that I've talked about on a previous show is, if you're on a Medicare plan that you're having issues with, or if they're making things difficult coverage-wise, if you're taking an insulin product, if you're using insulin, you can actually change your plan one time in the middle of the year.
Okay.
Where normally you would have to wait till open enrollment, which is October till December.
Right.
So keep that in mind, and that's something we also help with, is those Medicare plan reviews to make sure you're getting the best plan.
Yeah, because I'm not sure people know that either.
No,
that you can change it one time a year.
And that's a big difference, because normally it's, if you don't change it during open enrollment, then you're stuck.
And that's what people hear. That's what we've heard. So this is good news.
So if you're not happy with your coverage or your benefits, talk to your local pharmacy, and a lot of times they can help provide a Medicare plan review. We do that at Medical Park Pharmacy for free, and we just give you that information, and the patient can make that decision on what's best for them.
This is truly a community service, Thomas, that you and your pharmacy are doing at WHIG. We do appreciate this information, because I think we're hungry for information, but we don't always get it. We don't always get the skinny and the lowdown. So this is really good stuff, and I'm sure that the viewers are enjoying hearing this morning.
And one last thing, that getting back into cost. So if you're a Medicare patient and you're on a really tight fixed income,
yes,
there are some options out there for you. You can actually apply for something called Extra Help through Medicare, where you can get some assistance, and that goes through the Social Security office. You can get assistance with paying your premiums on your Medicare plan, and you can also get assistance on paying your copays. So talk to your pharmacist about that as well.
Okay, very good. Anything else in closing that
well,
you'd like?
We're again so happy to be here and talk about some of the nuances in pharmacy that can be really confusing for patients. And so come see us at Medical Park Pharmacy at 901 North Winstead Avenue, Suite 100. We're in the Medical Park building, or sometimes called the Boyce Willis Clinic.
Yes.
Across from the Shiny Diner, which they just tore down, unfortunately.
They sure did.
So I can't use that as a landmark anymore, but we're right across from the Harley Davidson shop. As soon as you come in, first door on your right, 252-443-7979, and we look forward to serving you.
Well, I was fixing to ask the number. Say the number again, Thomas.
252-443-7979.
Very good. And in case you just tuned in, great news. Repeat one more time. I have some people, I just turned it over there. So repeat one more time, Thomas, about the $35.
So if you have Medicare D or a Medicare Advantage plan and you're taking insulin, your insulin copay is going to be no more than $35 per month supply. And so no deductible goes into play there, no donut hole, $35 per month, which is just awesome news.
Yes, absolutely awesome for the public, for the viewers, for your, go see Thomas, go to Medical Park Pharmacy and let them answer your questions. They're so accessible. They're happy to work with you, happy to talk to you, and that's what we want to do. Shop local, y'all. We've got a shop local campaign going on right now.
I love it.
So shop local.
Yes, thank you. We'd love to help you.
Thank you, Thomas. We'll see you in 2 weeks.
Sounds good. Thank you, Sandra.
All right, we'll be right back with you right after this.